critical for advancement of knowledge and training our next generation that we have academicians. About at a meeting like this or at the SVS, a little more than half are in private practice or community practice, and probably about 45% are in academics. So I'm speaking a little more toward the academic pathway. But barriers that are harder now maybe than in the past are, the acuity of patients is increased as they age, and there's more comorbidities. As it's been widely disseminated, there's a shortfall in the number of vascular surgeons coming about, and projected over the next 20 to 30 years, that may be real critical. The SVS is working on that. And so we're, needed to do clinical work. Balanced against that is the need to, again, do research in areas that are relevant to vascular surgeons and vascular specialists, and training our young people. So I think the way to do this is to have environments, work environments and academic environments that promote the young academician. And so the ways to do that are increase the pipeline a little bit. So our training programs need to, at least some of them need to have built-in research time to be able to put out someone who is able to compete for grants, get extramural funding, participate in trials, publish and disseminate new knowledge. And that's critical for vascular surgeons. We don't want to be just technicians. Secondly, it's important for, again, training our new or the younger people, getting the academicians that medical students see are the role models oftentimes for what they become. So putting out a good role model, well-informed role models who are actively participating in research and clinical protocols and that type of thing. For junior faculty, they're kind of at the crux. So after they graduate from their either integrated residency or their fellowship, they decide academic or community practice. And if you decide academics, you have a lot of things to consider. One is where you're going to end up, and you want to end up in a environment that really promotes and makes academics the mission. So it's not just a big hospital that's, again, trying to drive the bottom line for more RVUs and that type of thing. It's one that might give you a little more time to, again, do research, as well as teach students, write, take some time to think, and that type of thing. That has to be offset by payment somewhere, and then usually that's dictated by the department chair, usually a surgery chair. So if you are looking for a place to go, it's important to pick a place that has a track record of training academicians and supporting academicians. For young people also, it's important, like with anything, to have a good mentor. Mentor-mentee relationship is really truly a win-win when it works out well. Both the mentor wins and the mentee wins. I will also remark that the SVS has been a good resource for promoting academic surgeons. They support a grant that basically doubles the amount of what's called a K08 or K23 award, which is a kind of the first grant people get before going on to independent extramural funding. And they've done that for the past 15 or so years, and it's really brought up a generation of vascular surgeon scientists. I was an award winner a long time ago now, so I think that's important. And then I'd say the other thing is it's important to maintain an environment to keep academicians who are working and being a mentor and that type of thing. You need to support them too, because there's some advantages when you're young. There's you get certain breaks here and there, but when you're in the middle level, it can get difficult to maintain that sometimes. So again, supporting that from the department level, allowing the more mid and senior level to have time to write and compete for grant renewals, that's important. Performing clinical trials and having the time to do that. So, I think it's one of these basic elements where you have to have academics to support and mentor the new people coming up, the students, residents, to stimulate people going into the field, and then again to disseminate and put out new knowledge.